I'm Dr. Chad Slaughter, and I'm a hospitalist at Candler County Hospital. Candler County Hospital has a lot of advantages, is that they have a very stable administration and a great nursing staff. And having that, it allows you to spend more time with the patients and their families. And a lot of times it's, it's trying to be supportive from not only a medical standpoint, but to support them and guide them through what is about to transpire. Well, working at Candler County Hospital as opposed to a bigger center, you definitely have a chance to treat a vast range of disease processes. If you were in a bigger area, you would admit a patient and you would consult some of the subspecialists. So the range and the diversity of the patients and their clinical presentation is unique. Definitely was impressed with the history of Candler County Hospital, and that it was one of the first hospitals in the state of Georgia to perform hemodialysis, and that was all because of the physicians who were actually practicing here. Just to hear the stories of their work ethic and all of the services that they would cover on a daily basis was very impressive. And I think Candler County Hospital is a very nurturing environment and allows you the flexibility to grow and to push the program forward in an ever-changing medical field.
I'm Dr. Leon Curry. After Vietnam, I came home to Georgia, and I was looking for a place to practice, and I looked all over Georgia and looked at a number of towns, and nothing came close to Metter, and so I decided to come practice in Metter. There was an aggressive climate to make Metter the best medical community that we could make it. This hospital has been on the forefront of medical advance since 1966. Candler County Hospital had a lot to do with the fact that physician assistants are allowed in Georgia. And this hospital participated in training the first certified, I'll say, PA in Georgia. His name was Hank Brainer. And then we led the fight in the Georgia legislature to allow PAs to become certified in Georgia. And we had the first case of CPR defibrillation succeed right here in this hospital with Ann Robertson and myself. And I was able to request and argue for a designed coronary care unit in conjunction with a nurse's station. That was the first time that the CPR and defibrillation had been done in Candler County and maybe in this general region. Our providing dialysis service became the first experiment in rural dialysis treatments in Georgia. Up to that point, one had to be at the Medical College of Georgia or in Atlanta with Grady Hospital and Emory University to dialyze. There were no rural dialysis units in Georgia until Metter began to dialyze. And we did this as an experiment to see if we could, along with the Medical College of Georgia, sustain a dialysis service in a rural hospital. And the experiment proved to be very positive. And some years later, community hospitals all over Georgia had dialysis units. We collected cord blood on 200 consecutive deliveries in this hospital for the purpose of measuring selenium levels, which was of interest to those interested in determining what was causing high blood pressure. That was exciting to us, to be part of the advancement in research on hypertension. In terms of teaching, we participated in in teaching nurses and teaching physician assistants. And we even had grand rounds on some weekends when I would fly to Charleston in my airplane and go to the Department of Family Practice and bring back to Metter 2 or 3 resident physicians who would spend the weekend practicing in our hospital and taking a patient and having a grand rounds presentation to our medical staff and nursing staff. And that was exciting to us. It kept us all involved in the academic aspect of medicine. We were trying to stay on the edge of medical advances in whatever manner or means we could. And that applied not only to teaching and research, but to medical practice. I think the accessibility of medical care here has been 24 hours a day for years and years and years. And, you know, for so many years, Dr. Pence, Dr. Robinson, and myself, and Dr. Smith provided not only office hours, but we managed the emergency room day and night for 20-something years before we started hiring emergency room physicians. So we were around the clock, available and accessible. This one-on-one relationship is better seen in smaller hospitals like ours, and we would try to stretch ourselves in whatever direction was needed to accommodate the needs in this community. We're family-oriented, we're people-oriented, and our patients know that when they come in here and they are served by our nursing service, who are friendly and warm and concerned and compassionate. They're not just professional, they are personal.
I think the most beneficial or rewarding thing from working in a rural hospital like Campbell County Hospital is I think the patients. I think there's definitely a personal closeness that you establish, a relationship that the nurses, the physical therapists, the techs, the house staff, the ladies that are in the cafeteria, everybody I think shows great care, great empathy for the patients from every aspect of their hospitalization, from the ER to the nurses to the techs to the people that are providing the meals, the people that are coming in and making sure they have a clean environment in their room have just been extraordinarily nice, polite, very caring. What you get back from the patient and their families far exceeds anything that you ever give.